Stop what you are doing for just a moment because the information I'm about to share with you could protect your life, your home, and the people you love. There is a dangerous virus that many adults have never heard about, yet it can hide in places that seem completely harmless. A garage, an old shed, a basement, a cabin, a storage room, or even a garden area that has been closed for months. This virus is called Hantavirus. And while it is not something most people talk about every day when it does infect a human being, it can become extremely serious very quickly, especially when it develops into a condition known as Hantavirus Pulmonary Syndrome. My name is Dr. Amanda Collins, and on this channel, I help adults over 60 understand the health warnings that are often ignored, underestimated, or explained too late. Today's topic is serious, but I want you to stay calm. The goal of this video is not to create panic. The goal is to help you recognize the risk, understand the symptoms, and know exactly what steps can reduce your chances of exposure. Before we continue, please take a second to subscribe to this channel and hit the like button. I share practical health information for older adults every week, and your support helps this message reach more people who may need it. Now, I want you to answer something in the comments. Have you recently cleaned a garage, opened an old shed, visited a cabin, moved storage boxes, or seen signs of mice or rats around your home? Write your age and your answer below. I read the comments, and your answers help me understand what topics are most urgent for this community. Now let's begin. Hantavirus is a type of virus carried mainly by rodents. The animal may look ordinary, and in many cases, the rodent itself does not appear sick at all. But the virus can be present in its urine, droppings, saliva, and nesting materials. The danger begins when those particles dry out, mix with dust, and become airborne. In simple words, you may not need to touch a mouse to be exposed. You may simply breathe in contaminated dust. That is what makes this virus so concerning. Imagine walking into a shed that has been closed for the entire winter. You open the door, move a few boxes, sweep the floor, and notice small dark droppings in the corner. Many people would simply grab a broom and clean everything quickly. But that is exactly the type of action that can send invisible particles into the air. Once breathed in, those particles can travel deep into the lungs. This is why hantavirus is especially dangerous for older adults. After 60, the body's defenses are not the same as they were at 30 or 40. The lungs may have less reserve. The immune system may respond more slowly. Chronic conditions such as heart disease, diabetes, kidney disease, or lung problems may reduce the body's ability to handle a severe infection. That does not mean every exposure leads to illness, but it does mean that adults over 60 should take the risk seriously. Hantavirus is not like a simple cold. In its most severe form, it can affect the lungs and the heart. The body's blood vessels can become leaky, fluid can build up inside the lungs, and breathing can become difficult very quickly. This severe form is called Hantavirus Pulmonary Syndrome, sometimes shortened to HPS. The terrifying part is that the early symptoms can feel ordinary. At first, a person may think they have the flu. They may feel tired, feverish, achy, or weak. They may have muscle pain, chills, headache, dizziness, nausea, or stomach discomfort. But then, after a few days, the illness may change. The breathing becomes harder. The chest feels heavy. Walking across the room may suddenly feel exhausting. A person may feel as if they cannot get enough air, even while resting. That is when this condition becomes a medical emergency. And here is something I need every adult watching this video to remember. If you develop flu-like symptoms after being around rodents, rodent droppings, cabins, sheds, barns, garages, basements, or dusty enclosed spaces, you must tell the doctor about that possible exposure. Do not assume they will ask. In an emergency room, doctors see many cases of flu, pneumonia, COVID, bronchitis, and other respiratory infections. Hantavirus is rare, so it may not be the first thing they think about unless you mention the exposure clearly. You need to say, I may have been exposed to rodents or rodent droppings. That one sentence can change how quickly the medical team considers the right diagnosis. Now, where is hantavirus found? Different strains exist in different parts of the world. In North America, some cases have been linked to deer mice. In South America, certain strains have also caused serious illness. In other regions, related viruses may affect other organs, including the kidneys. But no matter the region, the pattern is similar. Rodents carry the virus, people become exposed through contaminated environments, and the most dangerous cases are the ones that reach the lungs. The most important thing I want you to understand in this first part is this. Hantavirus risk is not only a wilderness problem. It is not only something that happens to hikers or campers. It can happen around ordinary homes, a storage space, a rural property, a vacation cabin, a garage that has not been opened for weeks, a shed where birdseed or pet food has attracted mice, a basement where old boxes have been sitting untouched. These are the places where many people accidentally expose themselves. But before we move on, remember this. Never dry, sweep rodent droppings. Never use a vacuum on them. Never stir up dust in an area where mice may have been present. That simple mistake is one of the most dangerous things a person can do. Now that you understand what hantavirus is, let's talk about the part that most people get wrong, how the virus actually spreads. Many people assume the danger comes from being bitten by a mouse or touching a rodent directly. And while direct contact or bites can be a risk, the most common danger is much quieter. The biggest concern is inhalation. That means breathing contaminated particles into your lungs. When infected rodents leave droppings, urine, saliva, or nesting material behind, those materials can dry out. Then, when someone sweeps, vacuums, moves boxes, shakes old blankets, or disturbs the area, tiny particles can float into the air. You may not see them. You may not smell them. You may not feel them. But if they are inhaled, they can enter your respiratory system. This is why old, closed spaces can be so risky. Think about a shed that has been locked for months. The air is still. Dust has collected on every surface. Rodents may have entered through small cracks, built nests, chewed through packaging, and left droppings behind. Then one day, you open the door, walk in, and start cleaning. That moment can release contaminated dust into the air. And for an older adult, the risk may be greater because the lungs are already more vulnerable. The tiny defense mechanisms inside the airways may not clear particles as efficiently as they once did. If a person has asthma, COPD, heart disease, previous pneumonia, or reduced lung capacity, the danger becomes even more serious. Now let's walk through what happens inside the body. After exposure, hantavirus does not usually cause symptoms immediately. That is one reason it can be so dangerous. A person may clean a garage today and feel completely fine for days or even weeks. The incubation period can vary. Symptoms may appear after 1 week, 2 weeks, 4 weeks, or sometimes longer. During this quiet period, the person may have no idea that anything is happening. Then comes the first phase. This early phase often looks like a common viral illness. The person may feel feverish, exhausted, weak, and sore. The muscles may ache, especially in the thighs, hips, back, or shoulders. There may be headache, chills, dizziness, nausea, vomiting, or stomach pain. At this point, most people would not think of hantavirus. They might say, "I caught the flu," or "Maybe it's a stomach bug," or "I just overdid it yesterday." And that is exactly why this virus can be missed. The early symptoms are not specific enough to sound unusual, but the clue is not only the symptoms. The clue is the combination of symptoms plus exposure. Flu-like illness after rodent exposure should always be taken seriously. Then, for some people, the disease enters a much more dangerous phase, the cardiopulmonary phase. This is when the lungs and heart may become affected. The blood vessels in the lungs can begin to leak fluid. The air sacs, which should be open and filled with air, may start filling with fluid. As that happens, oxygen cannot move normally into the bloodstream. The person becomes short of breath. At first, it may feel mild. Maybe they notice they are breathing harder while walking. Maybe climbing stairs feels unusual. Maybe they feel pressure in the chest or a sense that they cannot take a deep breath. But with Hantavirus Pulmonary Syndrome, breathing problems can worsen rapidly. This is the part I want you to remember. Shortness of breath after flu-like symptoms and possible rodent exposure is not something to watch casually at home. It is an emergency warning sign. You should not wait to see if it improves overnight. You should not assume it is just anxiety. You should not wait for a routine appointment days later. You need urgent medical care, and when you arrive, you must explain the exposure clearly. Say something like, "I cleaned an area where there may have been mice," or "I was in a cabin, shed, barn, or garage recently," or "I saw rodent droppings and then developed fever and breathing problems." This information matters. Treatment for hantavirus is mostly supportive. That means doctors focus on helping the body survive the severe phase. A patient may need oxygen, fluids, blood pressure support, intensive care, or mechanical ventilation. In the most serious cases, advanced support may be needed to help oxygenate the blood while the lungs recover. There is no simple home remedy for this. There is no supplement that reverses it. There is no reason to delay care. Prevention and early recognition are everything. Now, let's make this practical. The spaces that deserve your attention include garages, basements, attics, sheds, barns, crawl spaces, storage rooms, old vehicles, cabins, trailers, and areas where pet food, birdseed, grains, or trash may attract rodents. Signs of rodents include small dark droppings, chewed bags or boxes, shredded paper or fabric, nests, scratching noises, oily marks along walls, and a strong, musty odor. If you see these signs, do not panic, but do not clean carelessly. The most dangerous mistake is dry cleaning. Dry sweeping can push particles into the air. Vacuuming can blow contaminated dust through the exhaust. Using a leaf blower is even worse because it spreads particles aggressively through the space. Instead, the safest approach involves ventilation, protection, wet disinfection, and careful disposal. We will go deeper into that in the next part. But before we do, I want you to take action right now. Think of one place around your home that could have rodent activity: a garage corner, a storage shelf, an old shed, a basement, a cabin, a garden area. Write it down. Because after watching this video, I do not want this to remain information only. I want it to become protection. And if you are finding this useful, please click the like button and share this video with one person over 60. It may be a spouse, a parent, a neighbor, or a friend who has a cabin or storage area. This is the kind of warning people often hear too late. Now let's talk about what you can actually do to protect yourself. The good news is that hantavirus exposure can often be reduced with simple, practical steps. These steps do not require expensive equipment. They do not require panic, but they do require awareness and discipline. I want to give you 5 protection steps, and I want you to take them seriously, especially if you are over 60 or if you live with someone who is. Step number 5, inspect before you clean. Most people make the mistake of cleaning first and thinking later. They walk into a garage, see a mess, grab a broom, and start moving things around. But before you clean any enclosed or dusty space, you should inspect the area from a distance. Open the door. Look carefully. Do you see droppings, chewed materials, nesting, shredded paper, damaged food packages, small holes along the wall, a musty odor? Do not kneel down and put your face near the area. Do not smell directly. Do not touch droppings with bare hands. Open doors and windows first. Let the air circulate. If possible, allow the space to ventilate for at least 30 minutes before entering deeply. This simple step helps reduce the concentration of airborne particles before you begin. Step number 4, wear the right protection. A cloth mask is not enough. A loose surgical mask is not ideal for this kind of risk. When there is evidence of rodent activity, you want a properly fitted N95 respirator or equivalent protection, especially if you are cleaning or disturbing dust. You should also wear disposable gloves. Nitrile gloves are a good option. If the area is heavily contaminated, consider protective clothing that can be washed immediately or disposed of safely. After cleaning, do not walk through the house wearing contaminated shoes or clothing. Remove gloves carefully, wash your hands thoroughly, wash clothes in hot water if they may have been exposed. This may sound excessive, but compare that effort to the risk of a severe lung infection. A few minutes of preparation is worth it. Step number 3. Never dry sweep rodent droppings. This is one of the most important points in the entire video. Do not sweep dry droppings. Do not vacuum them. Do not use a leaf blower. Do not shake contaminated fabric or boxes. These actions can throw infected particles into the air, where they can be inhaled. Instead, the area should be wetted with disinfectant before anything is moved. A household disinfectant can be used, or a bleach solution prepared according to public health guidance. The key is to soak the droppings, urine stains, and nesting material before removal. Let the disinfectant sit for several minutes. Then, while wearing gloves and respiratory protection, use paper towels or disposable cloths to pick up the material. Place it into a plastic bag, seal it, and then place that bag into a second bag before disposal. After that, disinfect the surrounding surfaces. Hard floors can be mopped. Counters and shelves can be wiped. Items that cannot be disinfected safely may need to be discarded. Step number 2. Block rodents from returning. Cleaning once is not enough if the rodents keep coming back. After the area is cleaned, you need to reduce the chance of reinfestation. That means sealing holes and gaps where rodents can enter. Mice can squeeze through very small openings, so inspect around doors, vents, pipes, walls, and foundation areas. Store food properly. This includes pet food, bird seed, grains, and pantry items. Use sealed containers. Do not leave trash uncovered. Remove clutter where rodents can nest. If you have a serious infestation, do not try to handle everything alone. Call a professional pest control service, especially if you are older, have lung disease, heart disease, or immune system problems. There is no shame in getting help. In fact, it may be the safest decision. Step number 1. Know when to seek medical help. Protection does not end after cleaning. For the next several weeks after a possible exposure, pay attention to your body. If you develop fever, severe fatigue, muscle aches, headache, chills, dizziness, nausea, stomach symptoms, or especially shortness of breath, do not ignore it. The most urgent pattern is this: flu-like symptoms, followed by difficulty breathing after possible rodent exposure. That combination should send you to emergency care. And when you speak to the medical team, be direct. Tell them about the exposure. Do not minimize it. Do not say, "It was probably nothing." Say clearly, "I was in an area with signs of rodents, and now I have fever and breathing symptoms." That information can help doctors consider hantavirus earlier. Now, I want to add something important. Many older adults are independent, capable, and used to handling things themselves. Maybe you have cleaned sheds, barns, garages, and cabins your entire life. Maybe you are thinking, "I have done this for decades and nothing happened." I understand that. But risk changes with age. The same exposure that your body handled years ago may be more dangerous now. Your lungs, immune system, and cardiovascular system may not have the same reserve they once had. That does not make you weak. It simply means your strategy has to become smarter. Independence is not doing everything without protection. Independence is knowing how to protect your health so you can continue living actively. So here is your action plan for this week. Choose one area of your property that could attract rodents. Inspect it safely. Ventilate before entering. Do not dry sweep. Get proper gloves and respiratory protection. Store food sources correctly. Seal entry points. And if the job feels too large or too contaminated, hire help. Now we need to talk about the most important thing, recognizing the warning signs early enough to act. Hantavirus can be dangerous because it does not always begin dramatically. In the beginning, it can disguise itself as something familiar, a fever, body aches, tiredness, chills, a headache, nausea, maybe some dizziness, maybe stomach discomfort. Most people would not immediately think this could be a serious rodent-borne virus. They would think flu. They would think COVID. They would think a common infection. They might take medicine, drink fluids, and wait at home. But with hantavirus, waiting too long can be dangerous if the illness begins affecting the lungs. So I want you to memorize this pattern. Possible rodent exposure, then flu-like symptoms, then shortness of breath. That combination is urgent. If you have been around a garage, shed, cabin, barn, basement, storage area, old vehicle, or any place with rodent droppings or nesting material within the past several weeks, and then you develop fever and breathing difficulty, you need medical attention immediately, not tomorrow, not when it becomes unbearable, immediately. Shortness of breath may begin subtly. You may notice that walking across the room feels harder than usual. You may feel pressure in your chest. You may breathe faster. You may feel unusually weak when standing. You may feel like you cannot get a full breath. Do not dismiss this. In severe hantavirus cases, the lungs can fill with fluid quickly. Oxygen levels can drop. Blood pressure can become unstable. The heart may struggle because the body is not getting enough oxygen. That is why early recognition matters so much. Now let's talk about what to say when you seek care. When you arrive at an emergency department or speak to a healthcare professional, do not only list your symptoms, also tell the story of possible exposure. Say, I recently cleaned a space where there may have been rodents, or I saw mouse droppings in a shed or garage, or I stayed in a cabin or storage area and later developed fever and breathing symptoms, or I may have inhaled dust from a rodent-contaminated area. This is not extra information. This is essential information. Doctors cannot connect a clue they do not have. And because hantavirus is rare, the exposure history may be the detail that changes the entire direction of care. Now let's talk about the doctor conversation you should have before anything goes wrong. If you are over 60, especially if you live in a rural area, visit cabins, work in gardens, clean storage areas, or have seen rodents around your home, speak with your primary care physician about your risk. You can say, Doctor, I want to understand my risk for rodent-borne illnesses like hantavirus. I sometimes clean areas where mice may be present. What should I do, and what should I watch for? This conversation matters even more if you have chronic lung disease, heart disease, kidney disease, diabetes, immune suppression, or if you take medications that affect your immune response. Your doctor may not bring up hantavirus during a routine visit. Most appointments are short, and doctors have many topics to cover. That is why you need to bring it up yourself. Ask what symptoms should send you to the emergency room. Ask whether any of your health conditions increase your risk. Ask what your family should know if you become sick. Also, consider writing down your exposure history. If you clean a contaminated shed, cabin, or garage, make a note of the date. That way, if symptoms appear later, you can tell the doctor exactly when the exposure may have happened. This may sound simple, but it can be powerful. Now I want to give you a practical checklist. Before entering a rodent-prone space, ventilate it. Before cleaning, wear protection. Before removing droppings, wet them with disinfectant. Before assuming symptoms are harmless, remember the exposure. Before waiting at home with breathing problems, seek urgent care. And before the season of outdoor work, cabin cleaning, gardening, and storage cleanouts becomes more active. Talk to your doctor. This is how you move from fear to preparation. I also want to be very clear about something. This video is for education. It is not a diagnosis, and it is not a substitute for care from your own doctor. If you have symptoms, especially breathing problems, chest discomfort, severe weakness, or high fever, seek medical help. Now let's bring everything together. Hantavirus is carried by rodents. It can spread when contaminated droppings, urine, saliva, or nesting materials become airborne. The virus can be inhaled, especially when people dry sweep, vacuum, or disturb dusty enclosed spaces. The early symptoms can resemble the flu, but if breathing difficulty develops, especially after possible rodent exposure, the situation can become serious quickly. The most important prevention steps are simple: inspect safely, ventilate, use proper protection, never dry sweep droppings, disinfect before removal, seal entry points, control food sources, and talk to your doctor about your individual risk. You are not powerless. You do not need to live in fear of your garage, your garden shed, or your cabin. But you do need to respect the invisible risks that may be present in those spaces. A smart person does not wait for danger to become obvious. A smart person prepares before the emergency begins. If this video helped you, please like it, subscribe to the channel, and share it with someone over 60 who owns a cabin, cleans a garage, stores items in a shed, or lives near areas where rodents may appear. And now I want to hear from you. Have you ever cleaned a space where you saw mouse droppings? Did you wear protection, or did you clean it the old way with a broom and no mask? Write your answer in the comments below. Your story may help another person take this more seriously. Also, comment your age and the country or state where you are watching from. I read the comments and your answers help me decide what health warnings to cover next. My name is Dr. Amanda Collins. Thank you for watching. Stay informed, stay careful, and remember, the danger you understand is the danger you are much better prepared to avoid.